Oh, no, 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 no. Oh, gosh. Extreme magnet mayhem, popcorn panic, and the ultimate baked goods disaster. Get ready to laugh because today we're breaking down and reacting to all of the colorful medical scenes and over-the-top injuries from Happy Tree Friends. Let's dive right in. Oh, geez. Haircut? Yep. The scissors that a hairdresser barber uses, they are super sharp. More often than not, we actually end up seeing the haircut or a barber come in with a cut on their hand because of the scissors. Oh my gosh, it's a lot of hair. Oh, I will tell you, head wounds bleed like stink. You don't know where the artery is, you don't know where the blood vessel is, and I've taken off bandages that EMS had put on somebody's head, coated with blood. It's almost like a skin graft. Skin graft takes pieces like that. They actually put it through another machine that makes it into a mesh, so it covers more space. Nice. There you go. I mean, that is exactly what we would do in the emergency department, maybe with some gloves on. You wouldn't want to glue this down.
Steri strips, doc.
No, you wouldn't really want to do that either because there's always a chance that they will come undone. With this, you really want to tack it down, so you're going to use sutures. Oh, no, 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 no. Oh, gosh. Cuts in the mouth, they bleed a lot as well. The whole head and neck area bleed a ton. Here, getting good control of the bleeder is really hard. You'd probably have to intubate them. You have blood all in the airway. Oh, get your bread. So funny. Oh, jeez. Oh, man. Come on. Come on. I had a manhole cover somehow fly up on the highway, smash into the side of my car. If it was to hit a person, this is potentially what would happen. Cutting maybe epigastric area, maybe just below the diaphragm, maybe pieces of the lung, and then maybe liver, spleen on each side. Not bad. Oh, if patients accidentally shot themselves in the foot and it gets stuck in the bone, we get an x-ray first, see if it's truly in the bone, and then we just pull that sucker out. It's a puncture wound, increase the risk of different bacteria. Depending on if it's in the bone or not, do you need follow-up with orthopedics, wash out in the operating room versus antibiotics and watch. Why not?
Why not?
You're putting it through the foot. It can go right through the metatarsals. Very painful. Sometimes you can get lucky and go in between, but in between each of the bones is your nerves, muscles, and blood vessels. Oh, man. I've literally seen patients come in with fence injuries, not like this, but where the fence is impaled in. And you know what happened? They didn't pull it out, which is appropriate. They left it in place and then got to the hospital in a safe, controlled manner. What is this? What are they depicting? Tight roping. I'm assuming the intestines. Oh my gosh. The intestines do stretch a lot. They are a muscle. It can stretch pretty far. So when actually the opposite happens, when it gets cut, it shrinks down a ton. Same with your blood vessels. When they get cut, they just go massive different directions. So they're hard to find the ends of them. Oh my gosh, the teeth are gone. All the gums are gone. You would think that all the soft tissue around would melt into a piece of plastic device, but I guess not. Those are all molars. The molars have multiple roots like that versus the incisors are typically one. There goes the right side of the brain. Actually, sadly enough, when people get into bad car accidents, fall from really tall heights, and they smash their head, you can see brain matter coming out the skull if it's fractured, sometimes out the ears. Whoa. Uh-oh. Zoom. Be careful with irons, just like the guy from Home Alone. You can get smashed in the face. You can cause burns anywhere on your body. Usually people just drop it or trip over the cord. Oh my gosh. Just poked right into the eye. Don't immediately pull this out. It's probably enucleated the eye, meaning that the fluid in the eye is now gone. That's not really repairable. It's more of trying to make a cosmetic repair. That is a massive piece of steel. Based on the colorful stuff around, this piece of metal has ruptured a major vessel in your body, aka your aorta. Oh, butter popcorn. Burns. This is classic. Super common reason why people actually burn themselves is hot liquid that occurs at home. Most of the time it's hot water or like hot oils typically will spill on somebody and then cause the burn. Once the burn happens, there's not really much you can do to reverse it outside of your body healing it. Radioactive symbol. It's been pantsed. Ah, pants, so exposure. Got it. One disaster after another. If these colorful situations leave your stress levels climbing a little, Chillax by my company, Life Happens, is here to help. Designed to help you stay calm and find your chill. If you want to learn more about Chillax, find it on lifehappens.com or on Amazon. Typically, buses don't get in too many accidents, but if you do, usually it's on the news. When we see pedestrian versus car, we have a high index of suspicion for significant injuries. So most of the time, somebody's going to get a head-to-toe evaluation. Most likely CT scans and then any x-rays for the extremities. Oh my gosh, we got like Superman powers. In the trauma bays at the hospital, they'll actually increase the temperature of the area because when somebody comes in with a trauma, it will actually take off all the clothes, cut them off. The patient is exposed, which increases the risk of being cold, and you don't want the patient to be cold. Why are you doing that? Ashes to ashes, dust to dust. Now the radioactive material inside him. Oh man. It's very rare for anybody in the United States to deal with like radioactive poisoning. It's more related to like different toxins that somebody might be exposed to. It's something in medicine that we do differential diagnosis so we can think of worst case scenarios versus what it's most likely going to be. Happy Tree Friends, always very interesting, very intense. Gives us some material to talk about of what I deal with on a daily basis. So if you enjoyed this, definitely check out this playlist right here, binge watch everything. And please make sure that you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.